Hello everyone, and welcome to this PowerPoint entitled Documentation in Human Services. This PowerPoint is for HMS 248, Foundational Skills of the Paraprofessional. It is both written and presented by myself, Jordan Maynard, MSW, CSW, and your instructor for this course. In this PowerPoint, we are going to focus on documentation. This first slide presents us with the question, what is documentation? When you think of the word documentation, what comes to mind? Is it files? Is it papers, books, written records? Or is it paperwork that comes with furniture that you buy at the store that you throw away too quickly and then can't put the furniture together? Technically, all these things and more can be considered documentation. However, what we want to examine is what is documentation in regards to human services? Or, put in a better way, what is documentation from the perspective of human services? In its most broad definition, documentation from the perspective of human services can be defined as the process by which human service professionals systematically record information regarding their clients. Simply put, it's the process of writing down and recording things about our clients and their interactions with our clients every time we have those interactions with them. Whether those interactions be face-to-face, virtual, on Skype or Zoom, or by telephone or email. Anytime we have these interactions, we record the information. And that's what makes it systematic. It's systematic because we do documentation in a formatted way, which we'll cover in the next few slides. And we do that documentation every time we have an interaction with our clients. So now that we know what documentation is and how it's defined, the next question we have to ask is, what type of information are we recording? Simply put, we want to record all interactions we have with our clients. This includes intake informations, assessments, things like the biopsychosocial, interventions we use, outcomes of those interventions, referrals that we make on behalf of our client, referrals to other providers, or referrals to case management, discharge information, and follow-up information. All this information and more should be recorded and should be accessible in a client's chart, file, or their electronic health record EHR. And where you put this information will depend on the company you work for and what profession under the umbrella of human services you work. Some companies use charts, some use files, some use EHRs. It just depends. However, one thing that I want to make sure you remember is an axiom or a proverb or a saying that we use in all human service professions, whether you be a social worker, a counselor, a behavior analyst, whatever you do, or a mental health technician, whatever you do, you'll always hear this saying, and it's super important. That saying is, if it wasn't recorded, it did not happen. If you don't document it, it never took place. Therefore, it is important that you remember to document everything. And this includes all client interactions, whether they be face-to-face, virtual, telephone, and whether it be an assessment, an intake, session 1, session 3, a termination session. Document everything. So now that we know what documentation is, what it contains, and why, and that we should always document everything, let's look at why it's so important. Why is it important for human service professionals to keep proper documentation? Well, for starters, proper documentation is how human service professionals can monitor the progress of their clients. In other words, proper documentation allows human service professionals to see how far along a client has come since beginning treatment. For example, you may have client John Doe, and if you kept proper documentation, you can look and say, okay, on session 1, this was John Doe's presenting problem. This was the symptoms that John Doe had. And then, if you kept proper documentation, on session 10, you can go, okay, this is John Doe's presenting problem. These are the symptoms he's having. And with proper documentation, you can look and see whether or not John Doe's presentation has changed, whether his presenting problem or chief complaint is still the same, whether his symptoms have gotten better or have worsened. That's what proper documentation provides. That's why it's so important. Another reason proper documentation is important is because it supports evidence-based practice. And if you did your readings in any of the other classes, if you did your reading in this class, and if you've listened to me at all, you know that evidence-based practice is the gold standard in human services. Evidence-based practice is what allows human service professionals to provide effective and this is important, ethical treatment. Proper documentation is an evidence-based practice. Proper documentation allows human service professionals to see whether or not an intervention that is chosen is efficacious or if it's good for a particular client. Proper documentation allows human services professionals to monitor and modify or change treatment plans if they see that a intervention that they're using for a client is not working or is not efficacious. Proper documentation also provides research for human services as a whole by generating data for analysis that can later be used in research to, if the client allows, can later be used in research to come up with new interventions or change treatment plans for the future. So keep that in mind. Proper documentation is not just a good practice, but it's an evidence-based practice. Finally, another reason why proper documentation is important is because it allows for continuity of care. Can you imagine if you attended a doctor for years? Okay, imagine that you attend a pediatrician like we all do. You go to a pediatrician for 18 years. Then you become an adult. We know that when we become an adult, we can no longer see a pediatrician because pediatricians are for children and we are now an adult. So we go and find another doctor. However, upon finding another doctor, you find out that your pediatrician has suddenly lost all your information. So all the information about your shot records, your birth certificate, your vaccines, your medical history, any surgeries, any allergies, any medications, all that information is now gone. That would be frustrating, wouldn't it? Because now you're going to have to spend your next so many appointments trying to gather this information up somehow or go back over it all with your doctor, which would be very frustrating. Now, imagine if you were seeing a mental health provider or a human service professional in any capacity, whether it be a social worker or just any type of human service professional, and you'd been seeing them for weeks and you'd built this great relationship and great rapport in this therapeutic relationship, and then suddenly something happens and they can no longer be your human service professional. And you have to meet another one and start working with another one. You're transferred to a different caseload. If that takes place, can you imagine how frustrating and difficult it would be to re-explain your whole case and situation to the new human service professional? It would be very frustrating. Therefore, that's why we keep proper documentation. It's called continuity of care. Continuity of care, if proper documentation is done correctly, allows a client to go from one human service professional to another human service professional without having to try to re-explain everything, without having to have all this information that they have to provide, because it's already in their chart, it's already in their file, it's already documented. This is why we do proper documentation. With proper documentation, one human service provider can pick up where another human service provider has left off, and as a result, care can continue. Finally, proper documentation is important because it is ethically required. The National Association of Social Workers, the American Counseling Association, and the National Organization for Human Services all have ethical requirements for proper documentation. So not only is it good and evidence-based, it's ethically required for you to keep proper documentation. Now, let's look at some common types of documentation templates. There are three major types of documentation templates in human services. These include the SOAP note, the burp note, and the DAP note. The SOAP note is one of the most common, and it stands for Subjective, Objective, Assessment, and Plan. The burp note stands for behavior, intervention, response, and plan. And the DAP note stands for data, assessment, and plan. And as you can see, these note templates are slightly different in their formatting. For example, the SOAP note has subjective and objective. However, in the DAP note, that's combined into data, and then we have assessment and plan, like the SOAP note. And the burp note also contains elements of the other two notes as well. So although these are slightly different in their formatting, the central idea behind them all is the same: to provide an organized, formatted way of compiling client information. For this particular class, we're going to be focusing on the SOAP note, but I highly recommend taking some time to look at other note formats. In most instances, the agency you work for will be the determining factor for what note you use, or what note format you use. Here we have a SOAP note, and we have a breakdown of a basic SOAP note. So let's look at it step by step. In the very first box we have S, which stands for subjective. In this section, we report subjective information. Subjective information includes opinion-based information that the client has told you, the worker, about their goals, their feelings, and their progress. So this is information that is not based on fact, but is based on opinion. For example, if the client walked in and told me, I feel like I've had a terrible week. This is an opinion-based information. I would put that in quotes, and it would go in the subjective section. The next section is O, or objective, and it's the section for fact-based information or quantifiable information. This is information that can be observed, and it can include information such as the client's appearance, arrival time, generalized assessment scores, their race, their age. These types of things can go in the objective section. For example, if the client arrives 15 minutes late to an appointment, that is not an opinion. That is a fact. I can see the clock, and I can see that the client has arrived 15 minutes late. Therefore, it is objective information, and it goes in the objective section. Now, the next section, the assessment section, is a very interesting section because it is a synthesis or a combination of the subjective and the objective section, the S and the O section, above the assessment section. And in this section, we take information from both the subjective and the objective sections, and we use that to do the work of human service professionals. We use that to try to draw conclusions. We try to speculate on the potential problem areas that our clients may be experiencing. In other words, we take information from section S and section O, and we try to formulate and hypothesize on what's really going on for our client or with our client. Finally, P, section P, or plan. This stage includes your plan for the client's treatment. This section should include your client's goals, the referrals, their next appointment, that type of information, what's happening next. Here we have an example of what I would consider to be a good SOAP note. The following SOAP note is based, I'm going to give you a little background information where SOAP notes are used to document progress. Here's a little background information on what has been going on with this client. The following SOAP note is based on an example of an individual who experiences panic and anxiety when attempting to drive a vehicle. The anxiety began after the individual was involved in a motor vehicle accident. This is the 5th session with the client and the human service professional. With our SOAP note, as always, we start with the subjective. Client reports that he is still experiencing anxiety when traveling. Client stated that he is quote-unquote improving. Client states that he feels like the panic attacks will still occur when attempting to drive a vehicle. As you can see, in the subjective section, I put information that I'm told by the client. This is not information that is based on factual evidence, but it is based on the opinion and the experience of the client. You can see here where I put the client stated that he feels like the panic attacks will still occur. The client stated that he is improving. This is the client's opinion. It is not fact. It is subjective as opposed to objective information. In the next section we have the objective. Client appeared relaxed and calm this session. Client was well groomed and arrived at the session on time. Client reports successfully riding the vehicle with mother to the store twice this week. Client score of 11 on GAD-7. As you can see, all the information in the objective section is observable, quantifiable, and information based on fact. I observed that the client was calm and relaxed. I observed that the client arrived on time. I observed that the client was well groomed. I can observe that the client is relaxed. The client provided me with information he went to the store twice with his mother. The client scored an 11 on a generalized assessment. This is all factual information. And as we said, factual, not opinion-based information is objective. It's the opposite of subjective. Our next section is the assessment. The assessment says, client continues to make progress towards his goal of driving a vehicle without experiencing a panic attack. Client met his objective of successfully riding in a vehicle to the store twice this week. In this section, I am synthesizing, as we said in the previous slide, I'm synthesizing that information from the subjective and the objective section. Although the client is still feeling anxious, he has met his goal for the week. Therefore, I can assess that the client is making progress towards his goal, that he is improving. Finally, our last section is the plan. The client will continue to attend counseling sessions at the counseling place one time per week for 35 minutes. In this section, I have stated the client's future planning, including where and when the next section will take place. Now, this is by no means the default standard for SOAP notes. However, this is a good note as it hits all the requirements, and it doesn't have any of the bad documentation symptoms that we'll see on the next slide. Good versus bad documentation. Let's look at some of the differences between good and bad documentation. Good documentation is neither too wordy or too sparse, but it strikes a balance, providing limited necessary information. Remember, there's a fine balance there. We want to understand what is going on with the client. However, we do not have enough time, and when you work in this field, you never will have enough time to read pages upon pages of notes surrounding one session. So, with that in mind, be detailed in what you write. However, also be focused. Good documentation also utilizes proper spelling and grammar. If you wouldn't write it in a paper that you would turn into me or another instructor, don't put it in a note. Remember, for documentation to be usable, it has to be readable. Finally, good documentation avoids the use of slang words and instant messaging acronyms. Remember, you might understand what it means if you write, the client was based AF, no cap fam. Or, client ain't had a wink of sleep in 33 days. You may understand what either of those mean, or both of them. However, other human service professionals who have to read your documentation probably will not understand your slang or acronyms, so don't use them. Bad documentation does the opposite of what good documentation does. Bad documentation is either too short, not enough information, or it's too wordy, way too much information. Bad documentation is also full of spelling and grammar issues and utilizes slang. Earlier, we looked at what I considered a good, acceptable SOAP note to look like. Now, let's look at some bad SOAP note examples. Bad note example 1. Take a look at this SOAP note example. Is it good, or is it bad documentation? I'll give you a hint. It's bad! What are some of the problems with this note? Well, to begin with, there are several spelling and grammar mistakes in this note. In the subjective section, due to the grammar errors, it's difficult for us to tell who is talking. Is the client not sure why they are sad? Or is the human service professional unsure why the client is sad? As you can see, we have a need for spacing and better grammar. In the objective section, we see more grammar issues, but we also see information being left out. The client-patient scored a 7 on the depression test. What test is that? We can't just write depression test. We need to write something like the PHQ-9 or the GAD-7. We need that information to be specific. In the assessment section, we do see that the human service professional has somehow made a synthesis of the subjective and the objective section and wrote, client not progressing, but does not provide us with any information to justify this assessment. So, even though they wrote the client is not progressing, we need to know why that. What information gave them the idea that the client's not progressing. They also need to learn what spell check is. And finally, in the plan section, we have another lack of information. Client is coming back. When? When is the client coming back? How often? For how long? This is a note. This is an example of a note with too little information, and as a result, no insurance company will accept this note, and this note would be audited at any government agency. This is a bad note. Do not do this. Take a look at this note. Is it an example of good documentation or bad documentation? I'll give you a hint. It's bad! Although this note may appear to have less spelling and grammar errors in the previous note, it contains no relevant information to the client. It is simply a verbatim retelling of what was said by the client and the human services professional. Although this note only shows the subjective section, it is a prime example of too much information that is unneeded. All this information, where it's a verbatim retelling, it just fills up the subjective section and it tells us nothing that is important. Instead, it just repeats the conversation. Remember, more does not always equal better. As I said, be detailed, but be focused. Do not do this. A few thoughts to remember as we come to a close on this PowerPoint. Number one, documentation is not optional. It is your duty and requirement as a human service professional. Number two, documentation exists to monitor progress, provide continuity of care, and is part of evidence-based practice. Number three, and I repeat, document everything. This means everything. All interactions with clients require documentation. Remember, if it's not documented, it did not happen. So document everything. Finally, there are several different types of templates for documentation. SOAP notes, the burp notes, and DAP notes are all fine documentation. Again, this will probably, which you use, you'll probably have a preference for which you like, but the one you end up using will probably be based on the company for which you work. And finally, utilize good documentation practices. Documentation is pointless if no one can read it. Thank you for your time. Here's my reference page. If you have any questions or comments, reach out to me during my office hours. Have a great day, or not.